All right, good afternoon, everyone. Welcome to this press conference. We've just completed 2 days of meetings here in Singapore. We being the International Air Transport Association, IATA, which represents some 290 airlines from around the world. We met with about 140 different parties who are somehow connected to the airline industry and, as you can imagine, involved in the COVID crisis in some way. Our meetings focused on the medical, operational, regulatory, and communications aspects of what is a crisis for the air transport industry, as well as beyond that. We had very fruitful discussions over the last couple of days at a working level. So the objective of the meeting here was to sort of take stock of where the industry is in respect to working through this crisis, to understand if there are things that we need and can do better or need to reinforce, or if there's additional support that we need from other parties in order to do what the world depends on us to do, which is to link people and economies globally, safely, and efficiently. What we have here is a panel of people who were involved in those discussions over the last couple of days. To my left is Brian Pierce, who's our Chief Economist and Senior Vice President for Member and External Relations. We have Dr. David Powell, who's IATA's Medical Advisor. And we have Dr. Isaac Ogosh, who's an independent doctor who works for the University Health Network from Toronto, and an expert on epidemiology. These are just an example of some of the people who were involved. We also had involvement from the WHO, from PATA, from the International Civil Aviation Organization. And I guess the message I'm trying to send is that this is a crisis that the industry is united in trying to get through. There are lots of people collaborating and working together, including not just the industry, but also with governments. And we're very grateful for the help and support of the Singapore government, Ministry of Transport, in helping and facilitating this meeting here. I won't talk for very long. I'll keep my remarks sort of at that level. But what I would like to do is let you know that first we'll have a few remarks from Dr. David Powell. We'll talk to you about the medical component of the medical discussions that we had. And then we'll turn it over to Brian Pierce, who presented to the meeting a financial assessment of the impact that the COVID crisis is having on the industry. Those will be very short interventions, and then we'll throw it open to your questions. So with that, I'll hand over to David.
Thanks, Tony. So I was involved with the medical group here, which was some 20 or so airline medical advisors from all over the globe, who have been in touch with each other on a regular basis throughout the outbreak. As an industry, we come into this crisis with considerable experience already from previous outbreaks, SARS, MERS, H1N1, etc. But every crisis brings its own unique challenges, and we thought it would be valuable, as has on occasions happened in the past, to get together, regroup, and particularly to examine the guidelines which we already have in place prior to this outbreak, and check whether they are suitable and appropriate for the challenges that face us now. In so doing, we wanted to take in external expert advice, so we had Dr. Ogosh and a couple of other internationally renowned experts with input both on-site and by video link. And importantly, our well-established partners with WHO had input as well. One of our jobs was to, with them, review their draft guidance for aviation. By and large, I think the existing procedures, perhaps not surprisingly, are reasonable and appropriate, and we don't see need for massive change, but we've certainly identified a few areas that need a bit more examination, and a number of areas where we'd like to know more, and perhaps it isn't yet known, but it will be as the scientists continue to do their work. So that hopefully gives you an idea of the scope of the discussions.
Okay, thank you, David. Brian, if you want to lead us through your discussion of the financial impact.
Okay, thank you. Thank you, Tony. So I'm looking at the impact on the airline industry. You should have a pack. I'm also going to run through a few slides here. Just looking at the data, what we know has happened in the past. Typically, we've seen travel fall to a low point, perhaps three months after the outbreak of a disease, or an epidemic or pandemic, and then recover after 6 or 7 months. We really don't know whether COVID-19 will follow the same pattern and will have the same impact on travel. And I guess what we do know is that the global nature of this means that we're seeing outbreaks starting at a later stage, and so we could have certainly an extended period, even if it does follow the same V shape. Let me remind you of our earlier analysis, looking at the impact on the Asia-Pacific airlines. Even if we see the COVID-19 have the same impact on travel patterns as the SARS, with a recovery after 6 or 7 months, because the Chinese economy is so much greater and the Chinese travel market is so much greater, perhaps 4 times the size as it was in 2003, we are going to see a much bigger hit, more damage to Asia-Pacific airlines. So we're expecting a loss of something like 13% of passenger numbers in 2020, which in financial terms means a loss of something like $28 billion, which is a very large proportion of revenues for Asia-Pacific. So this is a very serious cash flow shock to the Asia-Pacific airlines. If the virus had been limited to Chinese markets, as you can see, the impact on airlines in other regions we thought would be relatively minor. But clearly what we've seen in the last week is a dramatic increase in the outbreak in regions outside of Asia-Pacific, and particularly in Europe, which means that this is now a global situation, and we're already seeing, if we look at the forward bookings of passengers, we're already seeing some very sharp declines. This shows the forward bookings for April. These are related to the number of cases in countries. Italy is not on this chart, but we're seeing similar declines. Airlines are reporting similar declines in forward bookings for the Italian market to what we've seen in China. So we are seeing this serious decline in bookings and revenues outside of Asia-Pacific now that this has spread more widely. We face a lot of uncertainties. We're not exactly sure what the pattern of the disease or the pattern of travel will be, and whether it or not it will be similar to others. We are really not sure of the extent of the spread. So we have looked at 2 different scenarios to give some scale of the challenge that airlines face financially. The first is what we call a limited spread, where we've looked at today the major centres of outbreak, where we're seeing more than 100 cases in those countries. In which case, we're expecting, as in Italy, to see travel fall in a way that we've seen in China. And we've also factored in a confidence effect, because we're also seeing bookings falling in markets which at the moment have got very few cases because of an adverse confidence effect. So even in that more limited case, we're expecting to see losses in excess of $60 billion in revenues for the industry, which is around about 11% of global passenger revenues. So again, that's a serious shock. It's double what we have been expecting for just the Asia Pacific region. As now this situation affects airlines globally. It could be that we see all of the countries with cases of more than 10 develop in a much more serious way along the lines that we've seen happening in China. In which case we could see the effect on revenues exceed 100 billion, around about 19% of global passenger revenues. So this would be a revenue shock equivalent to what was seen in the global financial crisis. So this, again, is a serious situation facing airlines. There is some alleviation in terms of cost. In particular, we've seen a sharp fall in oil prices. Fuel's the major cost for airlines. We've seen the spot price and also forward curves, which give an indication of prices for the rest of 2024 by about $13 per barrel. In a full year, this could save something like $28 billion from the airline's fuel bill, so there will be some alleviation here. Airlines are also cutting back on costs, as you will have seen in the press, but clearly, given the scale of the revenue shock, there's implications for profitability. Just looking at the financial markets, we've seen share prices for airlines globally fall 25% since the start of the crisis. So, a lot of this is priced in already in financial markets. And with the goal of maintaining connectivity, the goal of making sure that cities remain connected with air transport services, not just to transport people, but to sustain businesses and economies. One of the dangers at the moment is that the airline industry is very fragile given this sort of cash flow shock. And certainly, in order to sustain that connectivity for economies and citizens and population, will need support.
Great, thank you, Brian. So with that, we'll open up for questions. If I could ask you to raise your hand and let me know who you are and the outlet that you represent before you ask your question, that would be much appreciated. We'll take the first question in the second round. The mic is coming to you.
Hi, thank you. Aradhana from Reuters News. A few questions from me. May I just check, when was the last time that airlines lost this much in revenue? Was it in 2008? That is when I'm talking about the $113 billion estimate. Can you also please elaborate on how the corporate travel market is doing vis-a-vis the leisure market? How is the premium travel, how's premium travel demand relative to economy demand? And there have been some airlines that were struggling even before this outbreak, so do you expect any to go under because of this crisis?
The last time that the industry faced this scale of revenue shock, and I'd stress that what we presented here are two scenarios. There are lots of uncertainties here, but I think what's clear is it will be a sizable shock. And the last time we saw anything equivalent to the extensive spread scenario, it was in 2009 in the depths of the global financial crisis. We're seeing a significant fall in corporate travel. One of the sources of the fall of travel is actually corporate travel policies. Companies are stopping travel. But at the moment, we don't have the data to distinguish between whether we're seeing a sharp fall off in corporate than leisure. And I think that the industry remains very fragile. The improvements in industry financial performance in the last few years was driven by a relatively small number of airlines. There are lots of airlines that have got relatively narrow profit margins and lots of debt, and a cash flow shock like this could certainly send some into a very difficult situation.
Okay, take a question in the front row. Like this too.
Good afternoon. Gurdeep Singh from PTI. A quick question on that the Turkish airline plane left Singapore this morning empty, leaving behind estimated 200 passengers. Is this one the first case, and do you see such a scenario? I mean, this is really bad, and what's the fate of this 200 passengers sitting here in Singapore?
I think for that question, you're probably better to address to the principals involved. So we're neither the airline nor are we the government authority here who's managing that. So I don't think we can answer in specific terms.
Can you still say something, comments on this sort of scenario that's happening now?
Yeah, I think, David, I'll leave it to you to respond, but I think in general, what it points out is the need for standardization in how we treat these things. You know, the rules and the regulations that we face in different countries differ, and we know that in this crisis there are going to be difficult situations arising. The more standardized the response, the more efficiently the industry can deal with it. But maybe David, is there something you'd like to add to that?
Really, just to reiterate what you said, that it's partly why the WHO right now is trying to produce guidance for aviation, so that some of these more challenging scenarios about how you follow up a particular situation with a suspected or actual case, so that that's a clearer published and aligned guideline.
Okay, we'll take the question here in the second row.
Hi, I'm Tatiana from the newspaper. So following up on his question, there was also another passenger on Turkish Airlines. So what do you mean by standardization? And how do you determine whether one person is a close contact in an airplane? Because close contact can be within 2 meters in proximity or 30 minutes around the person. So say like a flight is like 45 minutes. Is the entire flight, in fact, can be possibly a suspect case or a confirmed case?
So there are a number of factors that come into the chance of transmission, and we spent some hours discussing aspects of that, but there are factors including proximity, time, and also how the person is that's unwell. That's probably the biggest factor, is how unwell are they at the time. Perhaps Isaac, you'd like to add?
I mean, certainly this is, hi, nice to meet everyone. Certainly this is front and center on many people's minds, the risk of acquiring a COVID-19 infection on an airplane. And, you know, to date, we've seen multiple flights and exported cases from affected areas, from China, from Italy, from Iran. And when we take a step back and look at the risk of transmission on the actual airplane with people who have symptoms, it's still remarkably low. And there's evidence in the medical literature, published in the medical literature, just published in the Canadian Medical Association Journal, one of the earlier cases that was exported from China to Canada, looking at 25 people in the 2-meter radius around a symptomatic individual on the airplane, and nobody in follow-up got this infection. Does it mean it's impossible to get an infection? Of course not. But the risk is extraordinarily low. And as was pointed out earlier, standardization of practices amongst airlines in the industry may help with the appropriate screening and contact tracing of individuals when this situation arises again.
Yeah, I think the answer to that is there isn't a standardized definition, but perhaps my colleagues here would elaborate on that.
Yeah, that's correct. And different, wherever the plane lands, the local public health teams will determine the degree at which screening will be conducted on the plane. And of course, this is different in many different jurisdictions, but what is commonly done is use a 2-meter radius around that individual. That's a very common practice. But of course, we've seen a lot of diversity in practice in multiple jurisdictions. So, but as you point out, that 2-meter radius is a very common theme, and that's a very safe thing. There is data backing that up.
Can he?
Hi, I'm Kyung-hee from Bloomberg. I wanted to ask you, you mentioned that the coronavirus this time is far beyond more serious than SARS. If you're saying that, does that mean that we might see a very late recovery in the aviation industry? And if so, how far beyond would we see before a meaningful recovery really comes back to the industry?
Well, I think we're all hoping that it will follow a nice V-shaped recovery. At the moment, we really just don't know. That is what's happened with travel, the travel pattern on previous disease outbreaks. But we're not absolutely sure. I guess what we do know is that this particular COVID-19 has now got several centres of transmission. So there's an overlap, and even if it does follow a V shape, we'll have a later recovery in Europe. There are possible signs of stabilisation in travel in domestic China, so that might be the case. Again, though, it is too early to say. So this could be extended, but I think the main point is it's been a much deeper fall in travel than we've seen in past episodes, partly as a response of government restrictions, which have been very restrictive this time around.
So are you saying that we might not see a recovery maybe this year, or do you think that might be?
So you could see the recovery within this year, or do you think that this could actually draw beyond this year and go into next year?
So the scenarios that we presented are based on an assumption that we will see a recovery to pre-crisis levels, late summer, third quarter. But even given that, which some might consider to be an optimistic view, even given that, because of the global nature of this, it still creates a big hole in airline revenues and travel numbers in 2020.
Yeah, Brian, maybe it's worth just emphasizing that these aren't predictions on behalf of the industry. These are scenarios. So if it evolves this way, this is what we can expect. But unfortunately, there isn't a playbook that we can refer to put our assumptions on top of. So we're laying it out there so that people can understand the potential damage to the industry. So, next question in the front row.
Thank you, Manchari from Aviation Week. A couple of questions. First, we see a lot of airlines and executives taking pay cuts and no pay leave and things like that. Do you think it's the best way for airlines to save themselves in the short term, or is there other better ways in the long run to save these airlines? And the second question is, do you think travel bans on the levels like Singapore, yesterday we see Singapore starting to ban visitors from Northern Italy, Korea, things like that. Do you think this kind of ban works? Because we do see some successes, or should I say, in mitigating the spread of the virus to Singapore. Do you think such levels of restrictions applies worldwide?
Okay. Yes. So we're seeing airlines, particularly in Asia, respond very quickly because there's been such a sharp fall in their revenues. Load factors have collapsed. Airlines are looking to take out costs wherever they can, and that's essential. There's a lot that could be done to help. I mean, one of the issues with airlines flying in and out of crowded airports, congested airports, is that there are slot rules that airlines must use their slots 80% of the time or they lose them. And IATA and the airlines at the moment are seeking a waiver on those rules, because you really don't want aircraft having to fly around burning fuel, generating CO2 unnecessarily. So we're asking governments to give some dispensation on that in order to allow the industry to adjust appropriately.
And also, I think we could say even more broadly than that, we're seeing governments come out with various stimulus packages for industry to ensure that the economies keep moving through this crisis. We'd like them not to forget the importance of the aviation industry in those considerations.
On the question of travel bans or travel restrictions, the WHO has never advised travel and trade restrictions during this outbreak at any stage, and that's still their position. Their stated rationale for that is that they tend to be ineffective and have very significant disadvantages, and it would probably appear that the progress of this outbreak has supported their position, because we've seen both that spread has continued and there's been major disadvantages. However, each country has to do its own risk assessment, and that having done so, many nations have decided that what they need to do is introduce those restrictions. Just as a side piece, what has certainly been effective and unprecedented is China's own restrictions that it placed effectively upon itself to contain the outbreak, and that the WHO would certainly acknowledge has been effective. Isaac?
Yeah, I completely agree with that comment. What we've seen and what data has shown from prior large epidemics is that when travel bans are enacted, they don't necessarily stop the spread of an infection. They might just slow it down by a few weeks. And each country will do what each country does, but the WHO has clear guidelines and recommendations on not imposing travel bans for that reason, and for the large economic footprint that they tend to leave. They also might facilitate more transmission of an infection in affected areas and do more harm than good. One last point on the travel bans is, at some point when we start to see a growing burden of infection around the world, it gets a little pointless adding a country and another country and another country to a growing list of countries, because you're essentially always a little bit behind and not predicting where this is going to go next. So, as Dr. Val pointed out, they don't tend to be very effective. They may slow down an epidemic slightly, but they would not stop it, and they're not that protective.
Take a question in the front row.
Hi, I'm Alfred from Flight Global. Just to follow up on the point of the travel restrictions and the travel bans, part of the contribution to the falling demand that airlines are seeing is in part due to the travel bans, travel restrictions. In IATA's discussions with the airlines and all that, what is the flavor of how they feel towards travel bans and restrictions? Do they see this as an overreaction, and what are they hoping for in light of these restrictions and bans?
I'll take a go, and then maybe David, you can support me. In terms of travel bans, we respect the right of governments to set these. We know what the WHO recommendation is, which is that there is no requirement for this. We recognize that governments, out of an abundance of caution in terms of trying to build confidence, take some measures. I think as an industry, our request is that we have some consistency, some advance notice, and absolute clarity so we understand what they mean. In some cases, we see these restrictions coming in very quickly and without good explanation. and we need to be able to deal with our passengers and to give them positive advice, and sometimes that's very difficult. So, you know, I think a great key word for this whole crisis is collaboration. And for sure, what the airlines are trying to do, what the governments are trying to do, what the health authorities are trying to do is absolutely aligned. You know, we want to be able to return to some sort of normalcy in the way that we conduct our business, run our lives, etc. And the way that we're going to get there is through collaboration, cooperation, and working together. And I have to say here in this last day, that's been absolutely evident with the Singapore government. So we've been super pleased with the response that they've given to us and the work that we're doing with them. I don't know if my colleagues want to elaborate on any of that.
Maybe just to mention that the WHO's international health regulations, which aren't binding, but they urge any countries during an emergency like this that institute travel bans to justify those as part of the whole WHO process. And now I know that they are working with many governments to understand the rationale behind those restrictions.
Okay. Maybe we'll take a question here, and then we'll move to the second row after. The first row, and then the second row after that.
Hi, I'm Justin from 2D. So right now the situation, we see a lot of commuters, our customers, they are really angry with the airlines because of the very frequent changes in the airline policies, waivers and refunds. So right now everything's pretty much in the air. Every airline has sort of has a different policy as to how are they going to refund it, how are they going to waive the change fees and whatnot. Is there a more sort of concerted effort by the airlines to, like, you know, standardize a certain protocol behind, you know, what to waive, what to not? And the second question is, we see also a lot of manpower issues with call centers. So the main frustration is also customers not being able to call into the airlines because I'm sure they're being flooded. So is there any, you know, policy that, you know, that can be in place to address this manpower issue with call centers?
Yeah. I think your questions are more for individual airlines. For sure, as the association, we can't get involved in individual policies with respect to refunds and things like that. Similarly, the manpower of call centers is something you need to address with the individual airlines involved. That's not something that we get into at the association level. Next question.
Good afternoon, it's Caroline from TTG. Apart from Pata, who was in the workshop, can you share who else were non-airline partners in the two-day workshop? What were some of their concerns and issues that they raised? Because the Global Business Travel Association did a poll of about 400 of their members, and the response was that there would be more than $500 million cut in corporate travel spending as a result of the COVID-19. So a lot of events have already been postponed or cancelled. ITB Berlin has been cancelled. It's supposed to be taking place right now. What kind of cooperation do you need from the partners? Because some parties are saying, let's continue to travel, we are in the travel industry. But companies are also tied because they cannot force their employees to travel. So what kind of collaboration or cooperation did the non-airline participants in your workshop raise and hope to find some sort of solution to this question for the travel industry?
Right. So we had some travel partners, for example, PATA was involved. I don't have the whole list in my mind, and I was only in the communications part of the workshop, so I have a somewhat limited view. But in some research that we did, we found that a number of companies have put in travel policies where they won't allow their travelers to fly to affected markets. And that certainly is having a dampening effect. Many companies have gone into crisis management mode. So in those circumstances, cost-cutting, travel gets cut, or the emergency response committee duties or the corporate emergency response plan takes priority and people aren't traveling for those types of things. So in that sense, there's not a lot that you can do at that point in time. But I think the discussion here was focused around trying to reassure people that the travel process is safe. So there are different reasons you can cancel travel. One is a business reason, another is a health reason. And the discussion here was not trying to influence people's business decisions because they will run their business according to the priorities of the business. But to make sure that we as an industry are doing everything possible to ensure that getting on an airplane is safe, that getting through an airport is safe, that people understand that staying in a hotel room is safe. So, and perhaps trying to encourage the industry to communicate a bit more effectively about the measures that it is taking to do those things, so that people whose corporate travel policies do allow them to travel feel reassured. So I think that for me was one of the big key takeaways from this workshop. Maybe my colleagues want to answer or add to that? No? Okay. At the back of the room.
Sorry, Shawa from Associated Press. Earlier on, you talked about the numbers for Asia. I just want to check if you have the numbers globally. Thank you.
Sure. Yeah, I mean, we said earlier that the Asia Pacific Airlines were likely to see a hit of up to 30 billion, 28 billion to revenues. Now that the crisis has spread to a global level, then we're certainly seeing damage in European markets in particular, but also in Middle Eastern markets. One scenario where there's very limited spread could see revenue losses of more than 60 billion, but we could see something in excess of 100 billion should this spread be wider.
Question over here.
Hi, Ajit from UOB here. I've got two questions. Firstly, how successful has IATA been in talking to governments or airports in suspending the 80-20 rule? Is there any governments which have agreed? I understand that the EU is very much against it. Can you clarify on that? The second question is, if a country were to apply travel restrictions, would it then necessarily follow that country's airport would waive or suspend the 80-20 rules?
Certainly on the first point, we have seen governments. In particular, we've seen the Chinese markets at either end of China. The slot coordinators have been very responsive to those rules in the immediate situation. But airlines will need some certainty to plan and to move their fleet to markets which are still seeing demand from consumers, and so they need slot waivers for a longer period of time, which has happened in some markets, and for instance in Australia, in parts of Canada. The European Commission, I think, are receiving submissions from airlines daily showing that their bookings are collapsing, and they really need the European Commission to follow the sort of waiver that they have given in the past in the case of SARS, or in the case not in the case of SARS, in the case of the global financial crisis. We think the evidence is very strong, so partial success at the moment.
Other questions? Here at the front row.
Hi, Yang from the Straits Times. You mentioned that one of the things that the two-day workshop intended to do was to get your airline partners to show that it's safe to get to the airport, get on the plane, get to hotel rooms. In that vein, have the discussions led to any kind of agreement to standardize going forward the announcement by airlines, for instance, that they will try to space out passengers on board the flight, or to try to give the window seats first, things like that to help to build this kind of customer confidence?
So I think we mentioned earlier that to date, there's no real evidence of transmission from one passenger to another passenger, despite the fact that we know there have been instances where people have flown, travelled, even when already sick with a fever. And so one of the questions that we asked in my group is you know, does that make sense to us that the risk appears to be low? And having reviewed that with the scientists, we think it does. And it is relatively reassuring, I think. But let's just remember that most of this outbreak has been driven by close contact with people who are significantly sick at the time. And by close contact, in the most cases, that actually has been household contact or healthcare worker contact. So whilst all of us have seen media reports of the exceptions to that rule, amongst those 90,000, 95,000 people, really most of them have been truly close, in other words, up close and personal with people unwell at the time. So I guess that's the message that we're anxious to get across, is that normal human contacts, such as all of you sitting there within a couple of feet of each other, is not really risky. And the aeroplane environment is probably less so than this room right here, because your average jet airliner has an air change rate that's 10 times what this room is.
Can I get comments on the situation of Indian market? This whole thing is coming back into India very rapidly, and the airlines are very weak. Could you just give us a comment on that one?
I'm just wondering what to comment on. I mean, we've not had the sort of damage, of course, in the Indian market we've seen elsewhere. But I think you're quite right that the market is relatively fragile with the airline's financial position.
So it sounds like there needs to be a major communications campaign, and I'm wondering which organization, is it IATA, is it the UNWTO, or other, like together with WHO, having come together to actually launch a communication campaign, because we don't want businesses grinding to a halt. For the corporate travel industry, it's already very bad. Similarly, for the events industry, people are afraid. So who will take the lead to mount this communications campaign? Do we need to do it now before it deteriorates further? And was that discussed in your workshop? And who's going to take up the call to get this going?
Yeah. I think we're at the stage right now where what you're talking about is a promotional campaign.
Getting the right information out to
Yeah.
people.
So,
Nobody knows, you have said something very reassuring that, to me at least, that if I decide I need to go to Beijing tomorrow to go and file my report or whatever, I will be relatively safe, I will be safe on the streets, I will be safe in the hotel. A lot of people don't feel that. And because Singapore, says, sorry, we're not allowing Italians coming in, people from certain countries not coming in, is sending a very, very strong signal. And the corporate travel companies and managers that I've spoken to, they are now all very, very cautious. And the CEO has to approve the travel plan. Without the approval of the CEO and the management team, nobody is traveling. And they are resorting to using phone calls or videos, to carry on the business. So the question is it now that we need to mount this communications campaign?
Yeah. So I wouldn't characterize it as a communications campaign, but one of the key things that we've been doing here is trying to get the answers to the medical questions that we can then transmit to customers through the intermediaries, so airlines or anyone else who wants to use the material. So our takeaway is, one of our takeaways, is to build that resource base that for sure our members, so the airlines, can refer to and rely on to help support their communications with their customers. And we also recognize that the credibility in terms of saying flying is safe or the aircraft environment is safe, the credibility of that message when it comes from the industry resonates differently than when it comes from WHO or from a doctor or from the medical profession. And that's clearly why we've involved the medical doctors from the airlines, but also external experts like Dr. Babosh over there, who's been very helpful in helping us frame the way that the messages of some of the things that we can say with assurance to passengers. And maybe I would turn to Dr. Babosh just to, maybe if you would summarize what advice you would give to a passenger who is considering not to travel because of COVID-19.
That's a great point. I mean, I think when people are considering travel, you have to think about several things. Obviously the destination, your home country, and how you're getting there. And the choice to travel, we have to think about what are the current rules and regulations. We know that certain countries have rules and regulations and advisories about going or not going to certain destinations, but we're not talking about that. We're talking about how you get to that destination. And certainly there's always a risk of acquiring an infection along the way through various mechanisms that are well beyond the plane itself. And of course, anytime we have lots of people congregating in a small place, there is the potential for something to happen, but that potential is extremely small. The risk is extremely small, and people can mitigate that risk further by practicing a few simple things. Number one, good hand hygiene. It's as simple as that. These are the same recommendations that we give during influenza season. These recommendations apply and are still effective, in fact, are very effective for this COVID-19 infection. This is a respiratory virus. There's droplets. The droplets can land on surfaces, and people can simply very effectively protect themselves by practicing impeccable hand hygiene. What does that mean? It means washing your hands with soap and water when you're in contact with high contact surfaces, or using an alcohol hand sanitizer. These are extremely effective mechanisms. I know it's simple, but it works. The second thing that people can do, easy to say but hard to do, is to try not to touch one's face. I know it sounds a little silly, but it also is extremely effective. Now, if you watch people closely for a period of time and they don't know you're watching them, they'll touch their face a lot. Not pointing, but if people are mindful of this, you can certainly reduce your risk. So, and lastly, we talk about coughing etiquette. If people are coughing or sneezing, of course, cough into your arm, not into the air around you, or not into your hands, where you can contaminate surfaces around you. And these are widely publicized behavioral modifications that people can do. They're widely publicized every influenza season. And of course, in many parts of the world, influenza season is tapering off, but we're still widely publicizing these as we see more COVID-19 infections, because these same simple practices will be effective in mitigating one's risk of getting this infection. And certainly, they will mitigate one's risk on an airplane as well.
I know you didn't give a forecast for cargo, but I would suspect that the cargo industry would be greatly affected, given that with the passenger planes being capacity being cut, that will basically remove all the belly cargo that can go into bellies and all that. So my question is, can you give us a sort of an anecdotal sort of like idea of how cargo is doing right now, given that the passenger plane's belly haul is sort of like, a lot of that has gone out of options for cargo side?
Yes, and I mean that's not the only influence on cargo. You're right that the grounding of many passenger aircraft has removed some of the capacity that would carry cargo around. But the fact is that today China is the manufacturing centre of the world, and China had stopped working more or less. China, I think today, is something like 38% of manufacturing. It was much smaller in the time of SARS. It is the site of many supply chains, particularly in the electronics industry, but also in pharmaceuticals. You know, a lot of those products travel by air, and they're vital for the modern economy. In fact, today, I think roughly half of international trade is in components because of the supply chains that are spread around the world, and air transport is vital to keep assembly, pharmaceuticals, electronics going. So it's really, I mean, the biggest effect has been the closure of the factories, firstly through the Chinese New Year, and then obviously the delay in getting people back to work. So I think for the most part, you know, there's been a very significant slump in cargo traffic. Data's been very poor, so we don't have the same degree of knowledge of exactly what's happening as we do on the passenger side. But it's a very difficult market at the moment.
And just if I could make one clarification, you said we didn't give a forecast for cargo. We also didn't give a forecast for passenger. We illustrated two scenarios, and just to be careful with that, because we don't want to be perceived as making predictions. We're only showing what might happen. Yeah, question.
Hi, Ling Zhi from Manila. I've got two questions. The first one is, what is the biggest like an agreement or achievement over this two-day workshop? And then the second question would be, as many of you has mentioned that the chances of getting infected in an airplane is extremely low, but people are not buying that because people are still very afraid. So are you thinking of doing anything like promotional campaign or stuff like that, to let the word, to spread the word out? Thanks.
In terms of an achievement, I think holding the meeting itself was an achievement. Reason being, we're in the middle of a crisis. Companies are in crisis mode. And what we wanted to do with this meeting was to take the temperature of the industry. That's probably not the right words for this. But for us, as their association, to understand what their issues were and what they needed us to be working on. So we are going away with this, coming away from these 2 days with a to-do list of things that we will handle. One of which is trying to figure out ways to better communicate the risk of travel. And we have some ideas as to how we might do that. We will be making more resources available to the airlines. We'll be doing some stuff ourselves. So that's the type of meeting this was. It was a working level meeting, not some meeting where we wanted to have a great signature on a beautiful document and say we've done something. This is really the industry coming together, understanding what we can collaborate on, and then coming away from the meeting with a long to-do list of things that we need to get on with. David, would you characterize it any differently, or?
No, I think you've summed it perfectly.
Does that answer both of your questions? Yeah. I mean, clearly people are holding back on travel. So we need to find a way to reassure them. And that's part of the to-do list of things that we have. But it's also mixed in with a lot of other things that we need to do, like getting alleviation on slot rules and getting some support from governments on taxes and charges, reviewing our guidance on dealing with communicable diseases. So there's a long list of sort of working list that we're coming away from. I wouldn't say negotiation. These are we're all in this together, and we were discussing what we can do or what the priorities for the association should be in helping our members through this crisis.
What are you hoping to receive from relevant business partners and stakeholders from this press con and from the 2-day workshop?
are we hoping to receive? Okay, so there are two things. Right? One is we held this meeting, which was gathering the partners together, our members together, and getting from them a clear message as to what would be helpful for them, for us to do. The second is characterized a bit by Brian's economic research. So by quantifying the potential damage to the industry, we're hoping that we get on the radar screens of governments as they're looking for towards what measures they need to take on in order to keep their economies going through this crisis. We recognize that the airlines aren't the only industry that's suffering. Lots of industries are suffering, but we want to make sure that governments understand the degree to which the industry is experiencing difficulties as a result of this crisis. And then hope that when they are talking about things like reducing taxes and charges or looking at landing fees at airports, etc. We've seen some great packages, leadership sort of coming from the Singapore government here on packages to support industry during these difficult times. We'd like to see more of that in other countries. Brian, would you add anything to that? Okay, maybe we'll go back here.
Thank you. I have a lot of questions on Kong Hee's cargo question. As we know, the Chinese factories are coming back to life right now. Do you foresee a quicker recovery in terms of the air cargo, especially in the freighter segment, when so many companies around the world are trying to get hold of their components made in China? Do you think the recovery is faster than passengers, or would it be the same?
I think that's probably true. And we typically do see that in the cargo business. After weak periods, there's a sharp rebound. As I said earlier, with extended supply chains, companies have been using up their inventories of components, finished goods, and so those stocks have been very low. So at some point there will be a restocking cycle which will cause quite a big demand for air transport in order to restock quickly. I'm not quite sure that we're at that point yet, but it's encouraging to see production starting to rise again in China.
I think we've got time for just a couple more questions, so we'll take the first row again.
Yes, you said in the slides that the worst case scenario, you see a more than $100 billion loss for the industry, right? So how does that translate to, in terms of the impact, how many jobs lost, and what other things will be lost in the process? And how does this compare to 2009 financial crisis, which you said was the only other time where you saw a comparable sort of deficit?
Sure. I mean, I'd emphasise that we think that there could be a hit of 113 or 100 or so billion dollars to revenue. So that's not a profit loss because there will be some offsetting reductions in costs in those circumstances. But clearly, that is a substantial hit to 2020 revenues. It's equivalent to 19%. The last time we saw a shock to revenues of that scale was the global financial crisis in 2009.
So how does this translate? How jobs lost? I mean, what is the sort of how do you translate it to terms that the layman can actually sort of?
Certainly, jobs are at risk. Yes, we're seeing that. We're seeing that already with a number of airline announcements, and airports are under pressure. I mean, everyone in the value chain will be feeling this pressure. And we've not done that translation. As Tony mentioned, at the moment there are so many uncertainties that we are presenting scenarios just to understand the scale of the challenge. But clearly, that sort of decline in revenues would mean that many jobs are at risk. And remember that we're not just talking about airlines here. I think one of the important roles that the air transport industry does is it connects cities in order to transport goods, people, investment. There are many jobs in the economy that are supported by the air transport industry. It could be adversely affected, if not lost, if there's serious damage.
Okay, one last question. Anybody?
Can I follow up on the earlier question of we were talking about the risk being low of transferring to another passenger, and comment was made, people don't buy that. I want not to answer your question, but to agree with that is our challenge, because there's a lot that people don't buy. But we have to keep on reinforcing those messages. You know, we have countries where there's one confirmed case that are selling out toilet paper. So people aren't actually necessarily responding rationally to this. We almost ran the whole world out of surgical masks. We're struggling to have enough masks for healthcare workers because people don't buy that message that the WHO's told them, that you don't need a mask unless you're looking after somebody who's sick or you're sick. People don't buy that hand hygiene, sanitizing your hands, coughing into your elbow, avoiding handshakes, not touching your face, is the best protection that there is for you. So we, I guess, appeal to you to get those rational messages out to people.
Sorry, Arana from Reuters again. How much of fares falling despite the cuts in capacity, or is supply matching? And also, I see that your scenarios have taken into account the number of cases as of March 2nd, but in some countries it's grown even higher. So I wonder if you think you might need to update it. Do you think even the $113 billion revenue loss figure could get worse?
I think it's too early to say what the impact on fares will be. I mean, certainly we're in the European situation at the moment, where we're seeing a sharp slump in bookings following the explosion of cases in Italy. We're seeing weakness across European markets. There's a big confidence effect, and certainly on some markets we've seen a 30% reduction in fares reported. There was a second part to the question, which was...
Can you repeat the second part of your question?
Because these scenarios take into account cases as of March 2nd,
yes,
I wonder if you think you may have to, could the situation or the $113 billion figure, could it get worse?
Well, certainly what is true is that it's a rapidly evolving situation. But actually in that extensive spread scenario, we have looked at all of the countries where there were cases were more than 10. I think that actually captures more than 80% of industry revenues. So I think that's in the right, certainly in the right ballpark. But you're right to point out that things are changing very quickly, which is why we've really just presented scenarios here to give a scale to the challenge, and we'll clearly be updating our assessment of the situation as the situation changes.
Yep.
Just to ask about the Tokyo Olympics 2020 that's going to take place starting in July. So do you feel any urgency that you have to do something about it, also like boosting travelers' confidence as to the impact with that, that people over the Olympics design?
I think in general, what we need to do is to boost people's confidence in flying. And I think Dr. Powell and Dr. Babosha have given us some excellent material in terms of placing the risk of flying in context. Specifically for an event or anything like that, I mean, there are lots of people who are thinking about how to ensure that the Tokyo Olympics are a great success, and I'm sure and hope that they will be. Our focus is much more broad on arming the industry with the messages and the information and the science to ensure that we're doing the right things in the industry to keep flying and to keep flying safely. And I know David has got a huge number of guidance materials and such available for the industry, which helps the industry to do those things. Your medical group has done a thorough look at all of those. Maybe you want to characterize some of those discussions, David?
There are existing guidelines on what to do, what cabin crew should do if there's somebody with a suspected illness on board, what maintenance crew and baggage handlers should do on how to follow up contacts, that sort of thing.
Yeah.
So all of that's been reviewed in the light of what we know about the virus and about the outbreak.
And in general, there was satisfaction with.
As I said at the start, in general, the procedures are good for purpose, as we would have expected, but there are a few things that we need to just look at and make sure, in the light of what we know, that they're right up to the minute.
Yeah. I mean, keep in mind, this is an industry that puts safety absolute top paramount of everything that we do. That's the safety of flight, that's the safety of our passengers, that's the safety of our crew, and that's the health of our passengers and crew. So these concerns or this type of focus is nothing new for the industry, and we've taken this opportunity over the last few days just to review and make sure that we're not missing anything. As I understand from David, we're pretty confident that we're doing things in the right way. Any other questions? All right, if not, thank you very much.